Hey guys, welcome back to my channel, The ENT Resident. Today I'll be talking about Guttman sign. Now, Guttman sign can mean different things in ENT in relation to the different areas. There's a different Guttman sign in the nose, in the larynx, and the thyroid. Today I'll be discussing about this and try to clear that out. For each sign, I'll tell you what kind of a sign is this? Is it a clinical sign or a radiological sign? What is this sign? Where do you see it? What is the reason behind it? And why do we call this? And maybe I'll also discuss a few high yield MCQs in relation to all of these signs that we are talking about. You can also now purchase my notes. I have added links in the description. So let's get started with our first Guttman sign, which is related to the nose. Now, this particular sign is a clinical sign where we see in a patient that there is nasal stuffiness or congestion occurring after a successful stellate ganglion block. As you can see, this is what is indicating towards. Now, what is the reason this is happening? When we give a stellate ganglion block, there is obstruction or congestion of ipsilateral half of the nose seen. That occurs because of the sympathetic block being given. We are seeing vasodilatation happening. And as a result of this, it leads to this nasal stuffiness or congestion on the ipsilateral half of the nose. And this typically indicates that the block has worked. Now, why is this called Guttman sign? This is clearly an eponym. What do you mean by an eponym? An eponym is a named sign, named after the person who first described it. So Guttman first described that nasal congestion is a marker of sympathetic block success. And that's how we end up with this Guttman sign, which we see in the nose. Now let's know some few MCQs that are important and related to this. So the most important sign of successful stellate ganglion block is not Guttman sign. The most important sign is to see a ipsilateral Horner's syndrome. Now, what is Horner's syndrome? What is the classic triad that you see in Horner's syndrome? We see ptosis, we see meiosis, and we see anhydrosis. This is the classical triad that we see in Horner's syndrome. An ipsilateral Horner's syndrome is the most important sign of a successful stellate ganglion block. And what is the earliest clinical indicator of a successful block? That would be ipsilateral ptosis. And last question related to this is, what is the stellate ganglion? Stellate ganglion is formed by the fusion of the inferior cervical and the first thoracic sympathetic ganglion. The fusion of this forms the stellate ganglion. So that's about the Guttman sign in the nose. Now let's see what is the Guttman sign in the larynx. Now this is actually more of a test than a sign. So this is basically a clinical test where we use this test to detect superior laryngeal nerve paralysis. And how do we do this? We try to observe the abnormal pitch changes happening in the voice when we apply pressure over the thyroid cartilage. Now let's talk about how are we eliciting this and then what do we see. So what we do is we ask the patient to sustain a vowel sound, like for example E, like to continuously keep on saying E, and while they are saying this, you apply pressure on the thyroid cartilage in two ways. First, you apply the pressure laterally and then you apply the pressure anteriorly. And when you do this, try to observe what is the pitch changes happening in your patient. So in case of a normal person, what we will see is when you apply lateral pressure over the thyroid cartilage, there will be increase in the pitch of the voice. And when you apply pressure anteriorly, there will be a decrease in the pitch of the voice. What will happen in case of superior laryngeal nerve palsy is this response will actually be reversed because superior laryngeal nerve is the nerve which supplies the cricothyroid, and cricothyroid muscle is the muscle which is responsible for the pitch of the voice. And that is why you will see a reversal on the pitch on these different pressures that you are applying on the patient. Now this is also an eponym meaning it was named after Guttman, who described this pressure-induced pitch reversal which happens in superior laryngeal nerve palsy. Now, specifically, the nerve involved over here is the external branch of the superior laryngeal nerve, and the muscle that is involved over here is the cricothyroid muscle. Can you tell me a very common cause of superior laryngeal nerve palsy that we see in ENT cases? That would be thyroid surgeries. That is a very important cause of superior laryngeal nerve palsy in ENT. Now that brings us to the last Guttman sign which we see in relation to the thyroid. Now what is this? And this is also a clinical sign, but this sign we are able to hear on auscultation of the thyroid. What is this sign? Guttman's sign is the presence of a thyroid bruit which is heard in patients with thyrotoxicosis. And the most common condition, most classically, it is seen in cases of Graves' disease where we see thyrotoxicosis, and that's where we hear this thyroid bruit. Now, what is the reason behind this bruit? Because we know in Graves' disease, there is an increased vascularity and blood flow which is seen in this disease. As a result of this, we are able to hear the bruit when we auscultate over the thyroid gland, and this is typically a systolic bruit. How do we elicit it? We'll ask the patient to hold their breath, and then we'll auscultate over the thyroid lobes and try to listen to the bruit. So this is what Guttman's sign means in relation to thyroid. And again, this was named after Guttman. This is also an eponym who first described the bruit as a clinical marker of hyperthyroid vascularity. Now, a few MCQ questions before we end our class today is, what is the most common cause of thyrotoxicosis? That is Graves' disease. And Graves' disease is a disease where we are seeing antibodies against the TSH receptor. And what is the classical triad that we see in Graves' disease? We see thyrotoxicosis, we see goiter, and we see ophthalmopathy. Can you tell me what is the eye sign specific to Graves' disease? Now we know there are a lot of thyroid eye signs that we'll study about. I'll make a separate video on that. But typically what we see is exophthalmos of the patient in case of Graves' disease. And one dermatological sign which is specific to Graves' disease is pretibial myxedema. So that's about the Guttman sign in relation to thyroid. And I hope I've been able to make you understand about the 3 different Guttman signs that we see in ENT. That's all for today. I'll see you in my next class. Thank you.